Good evening, good morning, good afternoon. This is TMS Roundtable Global, and we are global. Our guest is in Oregon. Rose, my co-host, is in Melbourne. I am Dr. Tova Goldfein in Israel, and I'm just so happy every Monday night. Hi, Rose.
Hi, Tova. Good morning. And good morning, Dr. Clarke. Thank you for joining us.
Thank you for having me. A good day and shalom.
Yay. Now, Dr. Clarke, are you the president of PPD?
Yeah, the PPD Association, yes. We're coming up on our 10th anniversary, and I've been the president the whole time.
Amazing.
Now, Dr. Clarke and his colleagues have changed TMS vocabulary to PPD to actually create a broader scope for physicians and for patients to see the global picture about chronic pain. Now, he was telling us that he actually didn't know about Sano until after he'd published his book. And someone in the audience at one of the presentations put up their hand and said, "You sound very much like Dr. Sano." Now, he had already written a book in 2007, They Can't Find Anything Wrong. So many of you may have already read that. But then Dr. Howard Schubiner in 2009 asked him to come and speak at a physicians' conference. So he became less, I use the word isolated, so that he became part of the mainstream of what it is to have medically unexplained symptoms, or even symptoms that are medically explained but have actually got an emotional background. Now, it was actually in 1983 that he realized that there was an emotional component to smooth muscle type anxiety, which is gastroenterology. Now, he mentioned to us, and hopefully he'll expand on that when he starts speaking, that for 8 years, no one made the connection in his medical school, in his training, about the emotional issues involved in our bodies, and that our bodies, as Sano would say, are one. Our mind and our bodies are one. So welcome, Dr. Clarke, and thank you for taking the time to be with us. Could you just introduce yourself or expand a little bit more and let the audience know that as a gastroenterologist, you've got a broad spectrum of understanding of the other issues that come from smooth muscle anxiety, and that the other issues within the body are often secondary, actually, from gastroenterology, aren't they? Like with heart issues, it's the same nerve that feeds the heart and the stomach, and people with chest pain can often have reflux because it's the same system. But we're moving off course. And also, would you mind giving us a little bit of a background to the patient that you cited in They Can't Find Anything Wrong, who only, she was so constipated, she only opened her bowels, every 4 weeks or something like that?
Yeah, once every month or so on the average, she would have a bowel movement. You would think, that you would get all kinds of toxicity from that. But actually, the human large intestine is a remarkable organ, and it keeps all those toxins from doing anything to us. And she was fine in that way. But she had been at 2 different universities, and nobody could figure out what in the world was wrong with her. And I was actually doing her exit interview, where we were essentially apologizing as an institution for not being able to figure out why she had this severe symptom. And she was taking laxatives. I mean, that wasn't the problem. She was taking 4 different laxatives at double the usual doses, and it wasn't working. And I was asking her about stress, and, of course, everybody had asked her about stress, but I asked her about stress that it maybe occurred around the time her illness began, which was 2 years earlier. And she was in her mid-30s at that time, but she took my question to mean stress way earlier, and began telling me about being sexually abused by her father, who had actually had intercourse with her an average of once a week from age 4 to age 12. And this was the first time, here I was after 4 years of medical school and 3 years of residency. So I'm in year number 8 of my training, and I've never had anybody share with me that they've, experienced sexual abuse. So I really wasn't prepared to follow up on this disclosure, but I fell back on the only training I had, which was to try to get a little more quantitative information about what she'd been through. And she's telling me all this in the same tone of voice you would use to read a grocery list. I mean, there wasn't any emotional content. And you could easily be deceived into thinking that she had fully processed this experience and that it was no longer an issue for her in the present day. And this was, again, the first time I'd ever encountered this kind of history. I didn't know what to do with it. I got the information in as accurate and complete a way as I could, which was, the training that I had when you encounter a symptom or a piece of history. And I sort of immediately went in search of Harriet Kaplan, who was a psychiatrist at UCLA, where I was in training at the time, University of California, Los Angeles. And I knew that Harriet was experienced in these mind and body issues. She was very unusually certified both in medicine and in psychiatry. And she said, sure, I'd be happy to see this woman and do what I can. And I kind of thought, this is going to be a waste of time. I mean, this patient is so ill. And that was my training. Again, it's embarrassing to admit as a physician that you can have, all of this education and not a bit of information conveyed that the mind and the body can affect each other in this way. So a couple of months go by, and I run into Harriet in an elevator, and I'm looking for a way to make conversation. And I asked her about whatever happened to that patient I had referred to her a few months ago, and the patient is cured. The patient is, she had no longer had any problems with her bowels. They had met once a week for an hour, and after 8 or 10 of those sessions, all the symptoms went away. She's no longer taking any laxatives. And it just completely blew my mind that you could alleviate a serious physical symptom like that just by talking to somebody. You would think I would have heard of that, somewhere along the way.
Can I interrupt, which I do very well and often? Okay. Please step back a second. You are saying I didn't have, the what to do. You are a human being talking to a human being. You did what naturally you asked the person about her. You put aside the disease or the condition, and you said, let me treat and talk to this person and see if I can help this human being who has the condition. You said it right here there it is in the book. Here it is, the quote. Here's the quote. It is more important to know what sort of person has a disease than what sort of disease a person has. So you yourself, give yourself more credit. You were a human being. You were a father at the time. Maybe you had children. I'm saying most doctors want to be a doctor because they want to help. So maybe you have some courses, but you used your humanness, and that's what's so beautiful about some of this work. The other day I was sitting with a patient, and he said to me, sometimes we just want someone to care.
It's completely true. But, that quotation from Hippocrates, and it's also Sir William Osler has been credited with that. It's absolutely true to knowing the person is so important. But at the time that I was, in year 8 of my medical education and training, I didn't know that. I didn't know that quote. I'd never heard that quote before. It hadn't been part of how I was taught to be a doctor. I was taught to, when you have a symptom, it's from an organ, it's from a structure. And if it's not from an organ or a structure, then it's not part of your job description and you can move on. I mean, that was the whole, both the explicit curriculum and the hidden curriculum. Find out what's physiologically wrong. And, that it turned out not to be correct. And when I first met this patient and I met Harriet, and I prevailed later on Harriet, you should really teach me some of these things that so that when I encounter another patient like this, I'll know a little bit better what to do, thinking that I would see maybe 5 or 6 a year in my practice once I got into private practice, which I began in 1984 in Portland, Oregon. And it turned out to be 5 or 6 patients a week. And there were no Harriet Kaplans in Portland, Oregon. So, I would send them off to the mental health department, and they were comfortable with mental health conditions, but with people whose main symptom was a physical illness, it was like, go away. And a lot of these patients, unfortunately, did not get help from that department. And they came back to see me and said, okay, now what do we do? And I struggled for 3, 4, 5 years. My department chair very kindly gave me longer appointments with these patients so that I could talk to them in more depth and try to understand what in the world was going on that could cause these serious physical symptoms. And I struggled. I mean, unlike most people who work in this field, I didn't suffer from this condition myself. So I didn't have my own personal experience to draw from. I had to start from scratch. There were no books. There were no textbooks. There were no training programs. I had no mentors. I was deathly afraid I was going to, do some serious damage to somebody. But even as a beginner in this field, I was getting better results than all the other people in the medical community here in Portland. I mean, just because if you give even a little bit of a step in the right direction, people start to improve.
They do.
It was wonderful. It was very rewarding personally, and it encouraged me to keep going with it. Plus the intellectual curiosity of trying to figure out what is really happening here. How can these people become physiologically ill? That's why my colleagues and I came up with this term, psychophysiologic disorders. We wanted a blend of psychology and physiology to be in the term that we use, because that's exactly what we found out is happening. And eventually, I kind of had a revelation that at the deepest level, people are experiencing emotions through their bodies. And both of you know this very well, but at the time I didn't. But it just kind of dawned on me that they were expressing emotions somatically through their bodies, rather than, so that my first patient, who was telling me about her severe sexual abuse in the same tone of voice you'd use to read a grocery list, those emotions were there. They just were not coming out in words or gestures or facial expressions. They were coming out in this profound increase in vagus nerve tone, or actually sympathetic nervous system tone, to her large intestine that was just shutting it down.
Absolutely. I have to say that I know that you love the science, and I love it too, and I know Rose loves it. But I keep going back to what I heard about Dr. Sarno, who, he said, I don't need to scientifically do this because people are just getting better. I don't have time to do the research. And you probably would have argued with him and said, come on, John, or something.
Oh, I would have loved to be able to do research on this. It became such a fascination. I mean, it was 35% of my practice for 25 years. So it was a lot, over 7,000 patients that I, interviewed in great detail. And I would love to have been able to do some research on this, but it took me 4 or 5 years before I even knew the right research questions to ask. And by then I was, so deep into a private practice that, I would have had to go back and do a fellowship. I would have had to cut my income by 75% to do that. I had a family at that point. It just wasn't going to be practical to become an academic physician. But I'm so grateful that others have taken on that load and have been publishing research. And, the bibliography that we have on the PPD Association website, it's over 200 references now.
Chock full.
Yes.
And they're all, each reference has a paragraph that explains it in plain English, so you don't have to be a researcher to take advantage of it.
Yeah, it's very comprehensive. If anyone wants to research any of these conditions, they're all there on that PPD website. Yeah.
Amazing.
Comprehensive.
Rose, you want to say something?
Yes, maybe. I would you mind actually talking about the whole general gastroenterology area and how, I've been curious about, people have complained about abdominal pain, and I don't know that the mesentery has an ability to feel pain as such. I don't know, but I'm thinking that also that abdominal pain that people have is not about the GI area. It's about either the mesentery or the muscles in the abdomen. Could you sort of expand on that a little bit to see if I'm on the right track or not?
Yeah, I think most of the time it probably is coming from the intestine when people have abdominal pain. Because it oftentimes correlates with what the bowels are doing. Some people experience increased pain when they're having diarrhea, or they're having increased pain in connection with constipation. So we know there's a connection to the motion of the bowels at that point. And we know that there's a good reason to have pain nerves in your bowel in case there's any kind of an obstruction going on that causes the bowel in front of the obstruction to become swollen out, and that stretch definitely increases the sensation. If you blow up a balloon inside somebody's intestine, that absolutely increases the sensation that people get. So there's definitely pain nerves in the wall of the bowel that respond to stretch. And when you have a signal, a stress signal coming down the sympathetic nervous system to the bowel that causes part of the bowel to contract, it's like squeezing a balloon. Some other part of the bowel is likely to stretch in response to that. So that's what causes the pain. And the pain can move around depending on which part of the large intestine is in spasm at any particular moment. And that's definitely a sign that it's not coming from a tumor or an inflammation. When the pain moves around from place to place, tumors and inflammatory conditions tend not to move around like that.
Could you also mention about referred pain? Because you would see a lot of that, I would imagine, in your rooms, in your practice, where the patient has got, the classical one for me is the gallbladder and the right shoulder. But in the GI world, it's like appendicitis. The referred pain is in the left iliac fossa, isn't it?
The appendix is in the right, but you can
but the referred pain.
You can feel a pain from it in the belly button area is very common when the appendix first becomes inflamed, and this is a function of the pain nerves getting a little bit mixed up on their way to the brain, so that when the brain is interpreting the signals that are coming from the body, it's getting a little mixed up about where they're coming from. Another classic example is in somebody who's having a heart attack. The heart is here slightly to the left side of the chest, but people who are having a heart attack can feel that pain in the left shoulder and in the jaw as well. And it's not because there's anything painful there, it's because the pain nerves are getting commingled with each other on their way up to the brain. So common phenomenon. And you mentioned the gallbladder also, the pain can be referred. One of the interesting things about abdominal pain is when you have pain in a very small area, that is less likely to be coming from something in the abdomen. The pain nerves that are inside the abdomen tend to be fewer and farther between than they are in, say, the skin. So that if you close your eyes and somebody pokes you on your skin somewhere, you can tell quite accurately where they've poked you. Inside the abdomen, it's different. And consequently, that when something is painful inside the abdomen, it tends to give the brain a sensation that the pain is coming from a fairly broad area. That's why when the appendix becomes inflamed, for example, it can start in the belly button area. And the gallbladder, an attack of gallbladder pain, typically from a gallstone, gets smeared out across the entire upper abdomen. Same with a peptic ulcer, can be across the entire abdomen, even though the source of the pain itself is quite small. So if a patient comes to me and says, you know, my pain is in an area, you know, the size of a silver dollar, and you know, we'd say in the United States, you know, maybe 2 centimeters, 3 centimeters across, that would be very unusual to be coming from something inside the abdomen. So I'm immediately suspicious that pain from a very small focus is actually a psychophysiologic process.
I'm gonna switch gears a little bit because I would love to hear from you. What is happening? Okay, you know, a woman comes in with pain for many years, and you find out it's something that happens every time she drives towards her, you know, to her parents' house. That's in your book, but I know you were able to figure out that she was anticipating and had a lot of anxiety once she went through by a certain area. It's not important, but I would love to hear from you. So she feels anxiety and she gets belly pain. What's happening between the brain and the belly? Like if she's going into fight or flight, yes, but that, can you describe maybe what's happening? Like I would love to hear your explanation, because there's many different ways to sort of say it, but I think this helps people have the knowledge of, oh, that's happening again, and they can sort of accept their pain, possibly, if we can hear your explanation.
Yeah, absolutely. I mean, when the sympathetic nervous system is active, you know, when we are in a fearful, anxiety-provoking situation, then the body needs to gear up to fight or to run away. And so the signals go out to the various areas of the body that need to be brought into play. And you certainly don't want to, you know, if you're having to run away from a tiger, for example, as we might have done back in the days when we lived in caves, we don't want to have to stop and have a bowel movement when we're in the middle of fighting or running away from the tiger. So the sympathetic nervous system slows the GI tract down. It shunts blood away from the digestive system and into the muscles of the skeletal system, so that we can fight or run. And that's why the sympathetic nervous system is connected to the GI tract in the first place, is to slow it down and take the resources elsewhere. It's, you know, it makes perfect sense from a survival standpoint.
Mm-hmm. So if there's blood and oxygen being taken for other parts of the body, that starts to cause pain. I mean, maybe not at that point yet, but the blood's not getting there. Then there's other compensation going on, but that person at some point will feel pain in her belly. And why does she feel pain in her belly and someone else gets a migraine?
Yeah, that's a great question. You know, why do these psychophysiologic reactions differ from one person to another? And we don't have a complete explanation for that. We know that various people with different manifestations of psychophysiologic disorders have different changes in their neuroanatomy in their brain. We've got functional MRI studies now, quite a few of them, that show that healthy people without these conditions process signals from the body with circuits in the brain that are different than people with, say, fibromyalgia or irritable bowel syndrome. And so that's certainly part of it, that when the signals from the body get to the brain, the fact that they're processed differently can make the sensation altogether different. You know, so that two people in a fight or flight situation may both be getting signals from the GI tract coming up to their brain, but they may feel it in a completely different way. The classic example of that some some of your other guests may have shared was a study in the British Medical Journal, not a study, but more of a case report of a construction worker who jumped on a nail. You've heard that one. Yeah. And so the nail is going, you know, through his boot, and he's in agonizing pain until they find out that the nail passed neatly between his toes and wasn't causing any tissue damage at all. So brain generated pain. That's, you know, such a common phenomenon and common denominator in this world.
Could I add to it, when you look at a little child and the child falls over and hurts themselves and there's no one around, they don't cry. But when they see mummy or daddy or someone else, they start crying because they're waiting for the reaction and the support or whatever. And, you know, I find that with chronic pain patients that it's often the support and the acknowledgement of their hurt and their emotional hurt that starts the healing process. It's a lovely experience to share with patients when that healing process begins to manifest. But
and people are, you know, reassured of their own value when that happens. And with many of my patients, a common denominator was that they grew up in circumstances where they were devalued. They were made to feel like second-rate human beings by any of a variety of different means. I mean, yes, it may have been the sexual abuse like that first patient, but it can be lots of other things. And so many of my patients have told me that nothing they could ever do was good enough to earn you know, reasonable amounts of praise and support from their parents. And so they grew up feeling like they just couldn't measure up.
And it also goes out to like school bullying and things like that when they come home and tell the parents and the parent says, oh, well, man up or whatever. And that support, like the parents could be really fantastic on the surface, or their caregivers. But then when an outside predator comes along, if we use that old saber-toothed tiger story, the support isn't back at home to allow that child to feel strong within themselves, within their bodies. So the pain becomes the resource that they use to actually get the support and the attention that they need.
Absolutely, that's a common pathway. Other patients of mine, they've not been allowed to express negative emotions in the home, or they've repressed those emotions because they are so focused on trying to solve the problems in the home. And so as adults, they're just not familiar with those negative emotions. And when they just start developing sensations in their body, they don't know to attribute those to an emotion. So they've got some kind of strong sensation in their body that any of us might get if we were very angry or very fearful or very ashamed, but they can't connect the bodily sensation with what an emotion is. So they can't say, oh, I'm having these feelings in my body because I'm angry. They don't know what anger is because they were never allowed to experience it as a kid. So they have this bodily sensation without the recognition that it's coming from anger.
Look, earlier on, when patients come in their unwellness, I'd say, rather than disease, or maybe disease if you split it up, is it like for some patients like an anathema to actually say that these issues you've got in your reflux or your various other problems are connected to your emotions? Do some patients actually push you away on that account? Could you expand on that a little bit for us so that patients can see that this is a normal reaction when someone says that, you know, you've got some other issues going on? Can you expand on that a little bit so that we can...
Yeah, you bet. That's actually the single most common question I get from my physician audiences is how can I possibly bring up this possibility with a patient without them being very resentful? Because the reaction they often get if they don't discuss it in the right way is that the patient feels devalued. They feel like their symptoms are not being addressed as real. They feel like they're being dismissed as simply being weak and not being able to handle ordinary levels of stress. So it's very important to tell people that these symptoms are absolutely as real as any other symptoms that I've dealt with in my practice. This psychophysiologic disorders was only 35% of my practice. The rest was garden variety ulcers and tumors and gallstones and inflammation. And the symptoms were no different. I had many patients in the hospital with this. One of my patients, I was consulted on her 70th day in the hospital. She was getting 250 milligrams of morphine around the clock for her unexplained abdominal pain, which is a dose you would normally expect to see in somebody with advanced terminal cancer.
Yeah.
17-year-old. So, very severe. Another one of my patients had a PPD for 79 years. So I reassure people the symptoms are absolutely real. They come about because of levels of stress that are well beyond what people are recognizing, and levels of stress that would bring an average person to their knees. So that my patients, I feel, are stronger than average psychologically, mentally, because they're like Olympic champions of stress. They're carrying a stress load.
How much pain can I feel and be numb? They're numb. Talk about controlling the body and mind. They're numb. They're past the point. They're like diminishing returns, when it comes to the pain.
Absolutely right. And I tell people too that the stress can physically change the anatomy of the brain. So that it will process signals from the body in a different way.
Wow.
And when people hear that, they're very reassured. As my wonderful colleague Howard Jubiner likes to say, that people realize, oh, the pain is not in my head, it's in my brain. And, and that makes all the difference in the world. It doesn't seem like much of a distinction, but it is a huge distinction.
Yeah.
And once people see that, then they're willing to get on the same page with me and say, okay, as part of a complete evaluation, and I do endoscopies on people to make sure they don't have an ulcer. Just because you went through stress doesn't mean you can't have an ulcer or a tumor or a gallstone. So I look for those things just to make sure. But as part of a complete evaluation, I take do what I call a stress evaluation.
I have it hanging up. Yeah, it's it's free. It's free on the site. Tell us about it, please.
Going through 5 different major sources of stress that can make people physically ill, just to make to be holistic about it, to get cover all the bases. Are you under stress in your life at the moment? And that includes people who take care of everybody else in their world, but neglect to put themselves on the list of folks they take care of. Stress from when people. Yeah, it's huge. And it oftentimes has links to childhood issues as well.
Right.
Because these are people who might have been the peacemakers, or one of my patients was doing the family checkbook from the age of 7 because both her parents were alcoholic. And every time she made a mistake, she just, she felt terrible, like a failure. So stress now, childhood stress, and then are they suffering from depression, anxiety, or post-traumatic stress? Because those conditions, all 3 of them, they're mental health conditions, but the majority of people who have them, if you take the whole universe of people who have one of those 3 mental health conditions, the majority will present first to their medical clinician with a physical symptom that typically the medical clinician will fail to see.
Unfortunately.
I'm going to answer a few questions. Here's Susie's question. Did you ever turn to Eastern medical paradigms for direction as you were learning?
I have looked at those and personally haven't found them to be as helpful. I mean, they have some very good metaphors in those traditions. And when I had patients who came from East Asia, I would sometimes bring them into play if they were natives of East Asia. But for the most part, I tried to go with a more Western physiologic approach because I think that made more sense to the colleagues I was working with and helped me gain more acceptance with them. And by a few years into my practice, I was getting referrals, not just for gastrointestinal symptoms, but for all kinds of stuff. And because people figured out that when they couldn't find a structural abnormality or an organ disease to explain a symptom, that, you know, probably Dr. Dave could figure it out. There was a gynecologist, you know, he would send patients to me with pain in the female pelvis. And he would also schedule those women for a laparoscopy procedure where you cut a small incision and you put a tube in and you have a look around. And he would schedule those at the same time to see me and to have this procedure, but he would always schedule the procedure for the week after they were going to see me in case I found some psychosocial issues that explained the person's pain. And he had a very good instinct for this. I think I found psychosocial issues to explain the pain in 100% of the patients that he sent. Wow. And he was able to cancel all of the laparoscopy procedures because when people start to get better, as you address the psychosocial issues, that's the proof of the diagnosis that you see improvement. So in order to communicate with Western physicians like that, I had to use the language of Western medicine, let's put it that way.
And it's also even more valued, even from an East Asian paradigm, that Western medicine is the cure-all. So, yeah, and I think the pharmaceutical industry probably helps that, doesn't it? Yeah. So
here's a big long question from Mia. You want to read that, Rose?
What about chronic, it's easier to read it on the side. What about chronic symptoms without logical pattern? Like chronic nausea almost 24/7, not like the example Tova mentioned, where it's obvious. The person visits her parents and then gets pain. But what if the pain symptom is always and random there? Also in consciously safe situations during sleep, etc. Could you talk a little bit more about this? Thank you.
Yeah, absolutely. And hello, Maya. The symptoms tend to be traceable to the same sources: stress, trauma, repressed emotions. And if we can find where those things are coming from, we can usually begin to treat them because they're almost always amenable to treatment. And then when we do that, we see the symptoms begin to improve. And now, you know, some people, short term, stirring up a lot of the sources of these issues can make people temporarily worse. There's no question about that. But for the most part, once you uncover the sources, people see it. And the bringing those issues into conscious awareness, you know, emotions that you didn't previously know were there. And now all of a sudden you see them and you feel them and you recognize them. And then you can put them into words. You know, once you're consciously aware of them, you can put them into words, written words, spoken words, to a therapist, to a computer screen, to a piece of paper. And the more you can put those emotions and traumas and stresses into words, the less they need to go into the body. And people begin to see improvement, and even a little improvement, even a short journey down a healing pathway gives people a lot of confidence that they're on the right track and they keep going. But, you know, regardless of whether the source of the symptoms is screamingly obvious, as it was in the woman who, you know, had the vertigo attacks, or if it's more subtle than that. I mean, I've had patients where we didn't really understand where the issues were coming from until we'd been talking for an hour, you know, and I've got, you know, 7,000 interviews in my head that I can use for context to, you know, to take a new person that I'm talking to and try to understand, you know, what the triggers are. And some of them are, you know, they're really subtle. I mean, one of my patients told me that, you know, after we've been talking for 45 minutes, he just remembered that the only time he ever got praise from his parents was when he could do something better than his brothers and sisters could do it. And he had three siblings, and they were all very accomplished. So it wasn't easy to do something better than they could do it. He could be the best in his class at something, but that wasn't good enough. He had to do it better than his brothers and sisters. And he just tried and tried and tried, every day of his life growing up to try to beat his brothers and sisters at something. And it was an incredible burden on him that he was still struggling with in his mid-30s. But it wasn't easy for him to come to that realization.
Yeah. One of the things while you were talking, Dr. Dave, was, and in relation to Mia and to patients that have actually had to go on sick leave for many years, actually, isn't it amazing? You'd think that they've taken away the stress from work, they've taken away the other stresses, but the constant pain stays. Like it's surprising. You'd think that with all our knowledge that stress is the problem, that then when we take away all the stresses, the pain still remains. Could you talk a little bit about that?
Yeah, well, you've gotten rid of one source of stress, but you haven't necessarily gotten rid of the others. Many of my patients are the kinds of people, and I mentioned this before, who take care of everybody else in their world, but they don't know how to put themselves on the list of people they take care of. And it reaches a point where they're on a treadmill, that they're just going every day, taking care of everybody else. And eventually their body protests and makes them ill and forces them to stop doing what they're doing for everybody else. And they don't know why. They're focused on the symptoms. They have the fear of the symptoms. And if the symptoms get better because they're now taking care of themselves and they try to resume their former lifestyle with no changes, the body will just do it to them again. You have to reach a point. You have to reach a point where you say, I am just as worthy of care and attention and support and personal time and joy as all of these people that I'm supporting. And until you feel that way about yourself, that you have that same level of value, that you're worthy, that you're deserving of self-care, then you'll never give it to yourself, and your body will keep beating you down until you do.
Well, and I'm gonna extend that a bit. I mean, we've met people that take care of their dogs and cats better than themselves, and they admit it, and it shows how difficult. I mean, these are good-looking people. I'm just saying, it's the difficulty to connect with yourself is something that is subtle. What do you mean? I like myself, but it's a layer. It's like the onion peeling. It's unbelievable. But chronic pain is like getting to know yourself.
Yeah, it's a message from your body that there are things that need attention. And for the particular subgroup that we're talking about here, people won't care for themselves. They won't take time for their own joy until they feel like they deserve it. And most of my patients who are in this category, they've been made to feel like they're unworthy. One of the questions that I ask myself about my patients is, what did my patient learn about themselves as a kid that isn't true? And oftentimes what they learned, we mentioned before that they're a second-rate human being. That's one of the common learnings that isn't true. But another one is that it's your job to fix everything. And if there's a problem in the family or elsewhere, you have to fix it. And so the kid becomes very focused on these issues that are in the family and works very hard to fix them. And so naturally, as an adult, they keep right on doing that. The idea of doing something for themselves becomes a foreign concept.
Yeah. Audience, could I interrupt for a moment and ask you to visualize that you're actually having a conversation with Dr. Clarke? Because this is what a physician and a doctor and a GP, it's the way they should be speaking to you all. So because there are so few of Dr. Clarke's around, I think it's up to the patient to actually see themselves as being, I use the word comforted, but it's the wrong It's actually the wrong word, but see themselves when they go to the doctor with a Dr. Clarke, actually put a Dr. Clarke mask on that doctor, if you know what I mean, and see that you're worthy and you're worthwhile, and that your symptoms are a cry out for support and help. But unfortunately, the medical profession on the whole aren't well trained in that area. So as you listen to Dr. Clarke and his beautiful warm words, I mean, you've really warmed my heart the way you speak about your patients and how you care. And I think all the doctors that the patients see, the doctors do care, but they just haven't got the training. So mentally, if you can draw on Dr. Clarke's words into your own life and see that it's good to go and check out with the doctor, but it's also more important to see that the pain and the suffering is more about your own inner life and being out there for other people, or accepting that the verbal abuse or whatever you're receiving, you deserve. But thank you, Dr. Clarke. It's just been lovely how you've described your patients. So it's just been heartwarming.
Well, I feel very grateful to my patients for the education that they've given me. I mean, they shared their lives with me in great detail, and sometimes I was the first or second person, ever to have heard the stories that my patients have shared with me, and it was a tremendous education. It's enabled me to put information out into the world that's helped a lot more people. I should add one last point about the folks that struggle to take care of themselves, that my treatment recommendation is, if they possibly can, and not everybody can do this, but if they can take a block of time every week on a regular basis to get out of their household and just find, by trial and error, an activity that has no purpose but its own joy, their own joy.
I'm going to write that down.
Like walking by the river, or
they can start like that. Absolutely.
An activity that has no purpose but their own joy.
The moral equivalent of finger painting for a 4-year-old. A 4-year-old doing finger paints has, doesn't care about the quality of the work. They don't care who sees it. They don't care how many pictures per hour they produce. They just know they're having fun. And it turns out to be an essential human skill. We all need something like that in our lives. My patients that I recommend to do this, number one, they feel like, well, gee, what am I going to do? I don't know what would be fun, because, they don't have, that in their lives. And number two, they're going to feel guilty because they're not doing what they usually do, which is to take care of everybody else.
So it can productive. It can become a habit. They can just we always say you get up and brush your teeth every morning. It becomes a habit. It can be learned. Because it begins to feel good, and then all of a sudden your body misses it. But I wanted to expand on, we're talking about being a parent, and we're all parents and we're all grandparents here. Thank God. And, Rose taught me a lot. Rose and I met through Michael Galinsky, and she was in Australia, and she did For All the Rage what I did in Israel. We just really, it's been wonderful. Michael Galinsky's been just a tremendous help in this show and continues to be. So I lost my train. I lost my train of thought. What was I talking about? Anyway, so, okay. And he's a parent now of daughters going to college. So parenting is the absolute hardest job in the world. And we mess up. It's a given. And we do something, and it could be interpreted or perceived by one child different than another. So part of it is what Rose has taught me, because I didn't know a lot about ISTDP till last year, is we have to sort of, deal with the anger, the disappointment, the grief, the sorrow about our upbringing, our childhood traumas, not blame, but make responsible maybe people that need to be. And then we take responsibility for what we're doing, what we're going to do with it. So that's it's part just to give. My saying is, no one's to blame, everyone's responsible. And my kids always tell me, no. And I think that's a good saying. I mean, think about that. So can you talk a little bit about being a parent, and now you're meeting people with childhood traumas, and we're like, get out the anger, give it to its due, radical forgiveness or radical anger. But I think it's about a balance, as long as you're not taking it in you, which is going straight to your belly or your migraine.
Yeah, I learned a lot about parenting from my patients that I'm very grateful for. Being a physician, I'm a very detail-oriented person and try to do everything in my professional life as well as I can possibly do it. And as parents, when we see our kids, we could potentially apply the same attitude. And whenever we see our kid, falling short, we could point it out to them and in the most, supportive possible way, and with the idea that we're trying to help our kid be the best that they can be. But if we do that all the time, the message we're sending is, oh, you didn't measure up here, you didn't measure up there, here's another place where you fell short, you could do this better. And after a while, it becomes pretty depressing. If there was somebody who came into my household today and started doing that, they wouldn't last very long before I drop kicked them off the front porch. So, but our kids don't have that.
You drop first and then you kick. Okay, I got it.
Yeah, it's a football term, an American football term. But yeah, so what I learned from my patients to do differently was to basically bite my tongue when my kids messed up, and to try to be an island of support for them, because particularly when the kids get to be adolescents, they are finding out all day long where they're not measuring up. It comes from their teachers, from their peers, from their coaches, from their, if they're in some kind of an extracurricular activity like music or theater, they're hearing from those people where they're messing up. And if they also get it from the home, then, where do they escape from, the constant noise that they're about their shortcomings? So I tried to make our home, and my wife did as well, a place where they were going to hear a lot more about how well they were doing than about when they were messing up. Because when they messed up, they already knew, they didn't need me to tell them. So I just tried to point out, where they had done things well, and, make sure that we were a place that they could go to where they would feel a lot more support than criticism, let's put it that way. And, they, that just made them want to do even better. Honestly, without any prompting from us, they heard a lot when we were impressed with what they'd accomplished, and that didn't make them want to sit on their laurels. It made them want to go out and do things even more. And we could talk for the next half an hour about my kids, but they did extremely well. I mean, they are national class athletes. They're both musicians. Both of them cook in their families and cook really well. They're both successful in their professions, and their wives and kids are amazing. So I'm could not be happier with how they turned out. But I'm not sure they would have turned out as well as they have without what I learned from my patients.
Wow. So one of the questions is, one of the Linda wants to know if you are interested did you write a book about your experiences in the office? That'd be a good book.
Well, the first book is basically 4 dozen case studies.
Okay.
The book, They Can't Find Anything Wrong, has got about 4 dozen of my patients to illustrate the spectrum of different kinds of stress that can make people physically ill. So that's a pretty good representation of the 7,000 or so folks that I drew those 48 cases from.
Yeah, right. And another comment was from someone who shares that, she cried a lot in her doctor's office and she didn't get any empathy. And it must feel horrible, to feel like you have to defend, doctors, because I try to look at what's going on with my doctor, that they can't be empathetic, but it's not so easy. There's a book I once saw that said, the patient will see you now. It's like, if the patient could be an equal opportunity with the doctor and there could be a dialogue going on, I think this particular patient would have gotten more empathy. And it's hard. Rose and I tried to get a doctor on the show who wrote a book about how hard it is to be a doctor and the stress of being a doctor. And I think that, but it's hard. I mean, this patient, she's saying she cried a lot and she got no empathy at all from the doctor.
Well, the doctor is trained to figure out, what is the organ disease or structural abnormality. And if the person's crying, well, it's not from an organ disease or a structural abnormality, so it's not my job description. And I have sympathy, but also embarrassment on behalf of the profession that we send doctors out into the world like they're trained to be plumbers, and then they find out that 40% of their patients need an electrician. And it's very frustrating for them. It contributes to the burnout issue amongst physicians, especially in primary care, but it's true of almost every specialty. What I'm focused on now is what's called integrative care, where you have a mental health professional working right in the same office with the medical professional, and the two of them talk to each other, and there's what's called a warm handoff, where the medical physician says, I'm going to have my stress expert come in here and talk to you for a little bit. And that turns out to work extremely well. There's an association here that puts on an annual conference that I've spoken at since 2009, and every year. And I think that's the way forward.
Excellent. Excellent.
Could we, before we finish off, would you mind talking again about your treatment plan and taking a block of time to, with no purpose, but to experience the joy? Now, a lot of patients will have that block of time, but then they will beat themselves up about having taken it. But one of the things I've noticed is that often their pain goes when they actually give that block of time. Could you expand a little bit more about that for them? Because I think that if that, Tova has this word of having a take-home, what do you say?
Take-home tool.
She wants a take-home tool.
Okay. Yeah.
And I think that's the essence of what you've been saying. That
I'm sorry I left one of my best ideas for the very end here, but in order to do that, to take that time for yourself and to feel worthy of that time for yourself, that where you're going for your own joy, you have to get to a point where you feel like you deserve it. And sort of an all-purpose useful technique for doing that is to imagine a child whom you care about growing up exactly as you did, enduring everything that you had to endure. And you yourself are transformed into a butterfly on the wall of your childhood home, and you're watching this child that you care about try to cope with everything you had to cope with. And you can't do anything about it because you're just a butterfly on the wall, and you're just watching. And you have to watch this kid try to endure all this for a week, 10 days, something like that. And that helps people to recognize the full magnitude of what they went through and gives them a much more accurate sense of just how strong they had to be to come through all that. And it can also connect them with emotions that they're experiencing in a much more direct way, because they're going to have emotions about that child that they're watching that they might never have about themselves. So it works, it's a thought experiment that is helpful in a variety of ways. But one of the most important ways it's helpful is to give you a greater sense of your own value, your own heroic perseverance, frankly. And once you start feeling that way about yourself, then lots of other good things happen, including feeling worthy of taking that personal time for joy every week.
Yeah. It's a beautiful, beautiful treatment plan. I love it. Thank you.
Thank you.
Yeah.
Any more questions before we're gonna wrap up? But I always like when we get
mainly comments. Isn't it?
Any more questions for Dr. Dave? Though I'm already thinking of how to bring him back for another round. But if anybody has any more questions that they'd like to ask Dr. Dave Clarke, I also wanted to look. I'm going to go out on a limb because I tend to do that And then Rose pulls me back. Oh, she's looking nervous.
I don't. I let her try it.
Yeah, she lets me.
Limbs are good. We need going out on a limb in this field.
Okay, so first of all, I want to comment on two things. One, every doctor that we've met, and the ones that we haven't been able to have on the show, that you guys are sensitive people. You got ladies, and there's something special about all of us that are in this field. That we're personally, I think we've all got our own traumas, and we just want to. We see how we've been resilient and we come through, but more what happens is that it's special doctors that tend to want to go ahead and do this work, which I want to make a point about that, because there's just incredible people in this field, and more we're meeting more and more. And Rose and I are privy to all these people who are healing themselves and then want to be a coach, and it's expanding. And I hope everybody's learning a lot and studying a lot and taking. I know you give a great course, you and Jessica.
Yes, on the ppdassociation.org website, we have
and it's a lot about trauma, childhood trauma, which is so important. Childhood trauma could just be the teacher telling you, something you don't want to hear. We're not judging how we perceive a trauma. It's traumatic to grow up in the world, especially in this century. The second thing I want to say is, this is the limb I'm going out on. I absolutely believe that whether someone has a structural problem, an organic problem, or not, or just an emotional problem, when somebody has pain, they're emotionally triggered. There are emotions around pain. People are uncomfortable with pain. They're not educated about pain. It's scary. And it begins the cycle. Even if it's a physical problem, it begins the emotional cycle, and then the physical problem gets worse. So here's the limb. Everybody can benefit from this work because we have an emotional reaction to what's going on, and it creates a chemical change, and it can make the system worse or not. So I just think this is very powerful for patients, for doctors, for the human race to understand pain, to understand that as we grow up, we get further from ourselves than closer, and that can create more physical situations. So what I think it's important. You don't have to agree with me. I feel like when you say I have a percentage of my patient who have, emotional, everyone's having an emotional reaction to their pain and can benefit from this work. And I think if doctors if the integrative, what you talked about, becomes the future, it will be wonderful for our grandkids, because that will be the way they'll be treated. It'll be an integrative affair. It'll be a multidisciplinary way they'll be treated. Can you comment on that a bit?
As was one of my colleagues, and I can't remember who first said this, but he said everybody who has a neck has a connection between their brain and their body. And we've all got one of these, so we've got a connection between our brain and our body, and those links are there. And in some people, 100% of their illness is due to a mind to body connection, and in other people it's a much smaller percentage. But the links and the interactions are they're always there.
Absolutely.
Mm-hmm. Dr. Alan Abbas has written a letter, I suppose, put in an article in Family Medicine about how doctors could actually expand without expand what's happening for the patient with how do you feel about this or that or the other. And so any medical people or any healthcare people that are watching today, I can actually send you a link to that actual article, because it opens up, a way of actually dealing with a patient so that you get the full history. And it's a lovely, pleasant way to actually speak to a patient. So anyone that is in that industry and would like to have that article, I can send it out.
Yeah.
And of course,
the PPD Association course,
yeah,
ppdassociation.org,
yes,
has a course on it. We have a textbook.
yeah.
And, the textbook is amazingly getting like 4.9 stars on Amazon, which
Fantastic.
there's Pulitzer Prize winning books that are only getting 4.6. So I was just really pleasantly surprised.
That is fantastic.
Excellent. And I would like to know, because we're ready for another movie, since This Might Hurt out and all that rage. So let's do a movie about Dr. David Clarke.
Well, I got a whole minute and a half in all the rage, so I was very happy about that.
Yeah, but
seriously,
you earned a movie, and what could it
yeah.
be about?
There is another movie called Pain Brain, which
Yes.
is in development that the PPD Association has sponsored. So we're hoping to see that later this year. In fact,
good.
They may be putting it out to some festivals. We're not sure where it's going to come out, but it's been shot. It's being edited. It's in post-production. So we're very excited about that. Their major research study from the Boulder back pain trial, we expect to be published in this calendar year. That is going to be huge because it will document in a randomized controlled trial the same benefits of talk therapy to a level that hasn't been seen before. So we think that's going to be a game changer as well.
I have a name for your movie.
Oh no!
Ready?
Okay. Yes.
The belly and the brain.
That would work. That would work.
I mean, isn't it our next show is going to be all about the stomach being a small brain, to be continued. Seriously.
Has a ton of nerve signals going to it. It has, the GI tract has been called a second brain.
Yes.
It has, yeah.
It's unbelievable. It's unbelievable. Yeah. Well, this has been absolutely just delightful, really, really. And thank you for being so available. I mean, you're busy. You're a grandfather. You're a father. You're a husband. You're probably still a doctor. And you really, really, really. Wait, there's one more question. You have a minute more. You're okay, Dr.
Oh,
David?
yeah. No, the grandchildren are on their way, but they're not here yet.
Okay. This is a long question from Jill, who I haven't seen. Good to see you, Jill. It might be a comment. Let's just read it. Is it absolutely necessary to find exactly the source? Is it absolutely necessary to find exactly the source of your stress? ? She said she had a good childhood. It wasn't perfect, but absolutely no trauma. Now, when her kids were young, she had a lot of stress and did not have support of her spouse. So definitely had a lot of anger and resentment at her spouse. But the kids are grown now and have been much more supportive. So she acknowledges that anger and resentment, but still have pain, physically doing more, but still in pain. Very empathetic person and feel everyone's pain and suffering.
Yeah. What happens if you don't find the source of your stress is that you're more prone to relapses of your symptoms.
Wow.
I mean, You may not get them again, but my experience is people are more prone until they trace the source of their symptoms all the way back to the roots and cope with that. And it's very, very difficult for many people to recognize the magnitude of what they went through as kids. One way to do it would be to imagine raising your own kids exactly the way you were raised. Now, I know that you said they're all grown up, but take yourself back X number of years and imagine yourself, that I took control of your brain for a month and I forced you to raise your kids exactly the way you were raised. And how would you feel at the end of that month? And if there would be some issues that would come up for you after that experience, that would very likely come close to the source of your stress. And that's what you should write about. We don't have, as human beings, a parallel life that we can compare ourselves with. So we just have the one life. And when we look back, we tend not to recognize the difficulty, the magnitude of the difficulty of what we went through. But imagining the same thing happening to an innocent kid that you care about can clarify a lot of that. And when you successfully recognize what you endured, and you get some of the emotions from it into your conscious awareness, and then write about those. That, in my experience, is what finally gets people past this illness and keeps it from coming back.
So true. And I think, Jill, I'd like to add is that to be in this journey, to be so self-compassionate and to be loving and gentle. It's not like you failed to figure something out. You're just on a journey. And it's not like a beginning, middle, and end. It's a lifetime. Right, Rose?
Yeah, and I'm just reading the question on the screen.
Yeah, this is for Linda. It's an interesting question. I followed for some time Dr. Joe Dispenza in his teaching, and he explicitly teaches not to go back to the stories from the past, but to change the emotion on the spot. I have left the work, but I know many who had healings following his work. What are your thoughts on that?
Yeah, I think you're treating the symptom and not the cause when you do that. And the tracing the emotions back to their source is not something everybody can do. It is, and when I say that, I mean, I'm talking about professional mental health therapists here. I mean, because people are not able to put it into words themselves. They're not able to recall what the emotions back then were because they had to repress them. So figuring out, say me as a therapist, trying to figure out what my patient has experienced with respect to repressed emotions when they can't put it into words requires a lot of skill and experience. I mean, you got 3 people on the screen here today who've got over a century of collective experience in doing this. So not to give anything away about our ages, but so we can do it. But
we're proud of our gray hair, right, guys?
Yeah. Well, it's all dye, but when people can't do it. Then they say, well, yeah, just change your emotion on the spot, even while the roots of it are still there boiling away. It's like putting a cork in a volcano. It'll work for a little while, but if the magma
comes out on the other side,
the magma is still boiling away, then your symptoms are going to happen again more often than not.
And we know from Dr. Sarno that some people will get better from reading the book, and some people will need ISTDP with Rose. So it just depends on the personality of the patient, and right, they have to accept who they are. It's a different personality, different trauma.
There's a spectrum, and there definitely are people who seem to achieve relief just from reading a book, and they don't need to go into any further depth, and more power to them. I mean, and there are other people where they don't need to read a book. The symptom the stress fades away, the symptom fades away with it, and they're fine because they had a relatively mild case of this. So, it's like any other form of illness. There's severe and there's not so severe and there's mild. But most of the people that will spend time, listening to a forum like this are coming from the severe end of the spectrum. And those are the people I want to talk to, the most today, because, the number of folks out there that can help you get all the way back to the roots is not that great.
Could I add on with Dr. Clarke about attachment style?
Very good.
Now, what happens with us is that our parents or our caregivers are unable to produce the amount of love that a child can give out, so they don't get it responded back. So the parent gives only what they've got because of that intergenerational trauma. And Dr. Davenlew and those sort of people have brought that into our mainstream understanding. So patients, when they have chronic pain, they've actually got a pain in their heart more than a pain in their body in a way. And the pain in their heart is about wanting to experience and express love and then it's not brought back to them. So be at peace, I suppose, with your pain, and be at peace with yourself that you've wanted to produce all the love in the world, but it hasn't echoed back. And that volcano in your gut wants to come up and explode, I suppose, because the pain, the love hasn't been recognized within you. And that attachment model will give you an idea. Secure attachment, insecure attachment. Oh God, there's 4 of them. And now under stress, I can't remember them. But you can Google it, or you can email me or talk to me about it, and I'll talk further.
Yeah, John Bowlby with Bowlby was another one of the great originators of that very important theory. But I like people to, as I say, when they recognize their own heroic endurance of what they came through, when they can see accurately how much they had to overcome, then they can give themselves a lot of love. They can see themselves as heroes of their own story.
Yeah, they're the heroes of their own story. Actually, that is Michael Galinsky's All the Rage movie. Anyone who hasn't watched it, please watch it to get an idea of how you've coped. And looking at it through the lens of Michael's life, you can see how you've coped. And also seeing Dr. Clarke in it, seeing Dr. Schubiner and Dr. Schechter, all of those people. And then those, I mean, in Australia, those famous people, but I don't think they're so famous here.
Yeah.
Who were they? Tobit can tell me.
Prince, and then Howard Stern and Larry David.
That's right. Yeah. So, you can get the whole picture there. Right. You get the famous people who have got the chronic pain. You've got actually the doctors who became aware of what was going on and how their healing model has developed. Mm-hmm. And you've got the patient and his family that brings in. And, like in that movie, Michael just stands there in front of his home and says, "My dad died. My dad died."
Right.
And all the feeling and all the anger and all the sadness and grief was allowed to come up. And he gave us that experience, that first-hand experience of his own life, for us to actually see our own lives through his life. How do I say that?
Well, trauma is, like I said, trauma is part of life, right, Rose? It's not bad or good. It's part of our perception. You can imagine being a little child and, it's just the world. It's like, I just think that Rose has taught me a lot about childhood trauma. And I realized when I took the course with PBDA, there's just a lot was focused about the trauma. I mean, it's really something you brought into the program about the childhood trauma. And Rose has taught me an awful lot about it and how important.
A lot of people feel like they didn't go through trauma because they weren't sexually abused or they weren't physically abused. But one of the things that came as a surprise to me early in my experience with this was that any form of treatment that makes the child feel like they're second rate is capable of having these long-term effects. And it doesn't have to be out and out abusive, with quotes around it. It can be just being made to feel like you don't measure up, or, not being able to fix your dad's alcoholism, or, lots and lots of different ways that, what people describe as trauma without a capital T. Those experiences can have exactly the same long-term effects as more obvious and more severe traumas.
It's like putting sandpaper on your heart, isn't it? Small trauma, small T. And it's not even seen. And it's also that perseverance that child can bring, and then they just give up in the end and allow the pain to take over. And the other thing,
more subtle too. I mean, it can be more difficult to recognize when it's not explicit and obvious.
Well, I love it when in the present moment with the patient and an old memory comes back and becomes integrated. It's just such a wonderful thing that it's been hidden away and in the safety of the therapy room, it can be brought back in and integrated. And it's just a beautiful experience for the therapist and for the patient to know that that trauma did happen, but it no longer is activated in their body. So, yeah.
Exactly. Yes.
Yeah. And Jan agrees with me about the sandpaper. Thanks, Jan. Yes.
There's just one more question I picked up from Jenny. Going back to a super stressful job in nursing after leaving it for 2 years because she developed symptoms. So any advice for being at a stressful job every day?
Well, it comes down to self-care, taking that regular time for yourself every week. And ideally, anyone who's back at your household will pick up any tasks that you're neglecting because you're focusing on yourself. You don't want to come back from a lovely afternoon and find a sink full of dirty dishes, for example. You need some support from anybody you might have in your household if possible. But to take that time regularly and do some trial and error, try something. If it's not fun, try something else. Everything you try, you will be teaching yourself about yourself. You'll be learning to play the same way children learn. And that ability to play is an essential human skill. And it will take all the stress from your very stressful job and bring it down. The strongest recommendation I can give.
Very good. Lovely. And don't take on board the stress of the stressful job. Yeah.
Rose would be able to talk about that, being a nurse for so many years. Give us some advice about that, Rose.
Don't take it on board.
Yeah, don't take it on board. I mean, how do you like, you say goodbye to a dying patient? How do you go home and how do you detach yourself from that?
You don't detach yourself. You allow it to be part of you because you've had that experience of being with a dying patient and helping them to cope with their death and being with them with their death. And you go home and you know that you've helped them have a good death. What more? Or a good delivery.
Right.
Or postnatally, know that the mother can breastfeed because of your interventions, that you've brought the mother into that coping sort of mechanism and that they can safely handle their baby without fear. And you go home and it's been a stressful day. And then you go home with that sense that I've done what I can do for that person. And I'm sure Dr. Clarke can expand on that even more than someone like me. Because that's the feeling, isn't it, that no matter how bad the situation has been, you've actually been able to move into that situation, do what you can with them, with the person, and then move out and know that no matter how bad it is, that you've contributed to their well-being in whatever little way you can. Would that be?
Yeah, absolutely. It's, any of us who work in a profession where we help other people, and especially when we become deeply involved in their lives, it's a very fine balance, and none of us does it perfectly. We try to remain empathetic and compassionate, but not to be so empathetic and compassionate that we fall apart ourselves with the
That's right.
emotional burdens. And we've all violated that on both sides. Some days we're not as compassionate and empathetic as we would like ourselves to be, and some days we bring crushing burdens home with us. And that's just the nature of the job and the fact that we're people.
It is, yeah. Yeah. And holding on to it when you can do no more is the sandpaper.
Mm-hmm. Yeah. Exactly. Well,
but at the same time, we get tremendous rewards when we have successes.
We do. That's what I mean. That is beautiful. But even when we don't have success, it doesn't mean that the patient doesn't see us as being their support.
Right.
Yeah. So that's the self-criticism that we hold.
Right.
That we haven't been enough, but we are enough.
Right.
Just by being present with those people.
One of my patients was not much better after, well, I know she was better after 5 years, but she wasn't cured, let's put it that way. And I asked her if she was disappointed, and she said, she'd made so much progress in those 5 years, then she could see she was still on the pathway toward healing. And that she was tremendously grateful. So I was afraid she'd be disappointed that after 5 years she still had symptoms, but not a bit of it.
Yeah. I mean, we're made for connection. I mean, that's why I use that word love. We're a herd animal, if you want to put it bluntly, and the support to one another is vitally important, because even if you've got self-criticism, you know that you've got a safe place in the world. And that was your response to, was it to Jan, your response? I can't see now on the side.
Jenny.
Yes. Yeah. So as long as you've got a safe space, and if that's walking by the river or taking a walk, and you people in North America have got a lot of snow and that, I can't imagine going out in that, but you probably have overcoats and boots, and you can go and experience that crisp air.
It's so true. The Hebrew word for nurse, it means the same word as sister. So because it's such an important job to be a nurse, I'm in awe of nurses. I mean, what an amazing feat to go every day to be a nurse. It's an amazing, you should be very, very proud of yourself, Jenny, for even choosing that job. You're a mother, you're a nurse. I mean, really. And you're human. Don't forget about that. So we're excited about your movie, The Brain and the Belly.
We'll see. Okay. We'll go for Pain Brain first. That's a movie about the research study on back pain in Boulder, Colorado, and we're very excited about that as well. I'm not in that one, but I'm working with the director.
Well, you're great on the side. You're terrific in the stands. You're this great cheerleader. So good to see you and your fabulous gray hair and chiming in from Oregon to meet with Rosie in Melbourne. I mean, is the internet really amazing? This is the good thing about internet. I mean, here I am in Israel, Australia, and we are really global, and this is just a thrill. I'm in awe.
I just wish we could do as well with COVID in the United States as they have in Australia and Israel.
Yeah.
Sure, but we've been locked down for a year, haven't we?
Listen.
I think we've got two people.
It's amazing.
There's always, we're not victims. None of us are victims. We'll find the gift. You've done that in your career. Rose has done that. I mean, Rose and I teach each other all the time about finding the gift and finding none of us are victims of anything. There's an amazing lessons in the world. So we'll invite you back, and I'm so thrilled that we had you on our show, and thank your family for sharing you. And if we can help with anything ever, Rose and I are here, and we're just thrilled to be living with you.
Well, thank you for bringing this information to the world. You've had wonderful speakers in the past, and I'm sure you will have more in the future. And it's a great contribution to the healing from this condition. So thank you.
Yeah, thank you. All right. Good night, everybody. We'll see. Rose is around to answer anyone's question. And we're we're on our Facebook, and this will be a YouTube. So we'll send you the link, Dave, so you can see what amazing job you did. Okay. Good night, good afternoon, good morning. Bye, everybody. See you next week.
Bye.
Bye-bye.